In the headlines, bandits kill 8, abduct 17 women in Katsina. Family of late Sylvester Oromoni criticized bail granted to suspects. NCDC says COVID-19 infections on the rise as Nigeria records 4,035 new cases. And on the foreign scene, United States approves first oral pill for treatment of COVID-19. Hello and welcome to Trust News Update. I'm Darshan Hussaina Usman. Now the news in detail. Bandits have killed at least 8 persons and abducted 17 women in Faskari local government area of Katsina State. Deputy Speaker, Katsina State House of Assembly and member representing Faskari constituency, Dalhatu Tafoki, confirmed this to newsmen in the state on Wednesday. Tafoki lamented that the area has been under continuous attacks by bandits in the last 5 days, noting that among those killed includes a man set ablaze in his car. He called on the state government to redouble efforts to ensure adequate security in the state. Meanwhile, on Wednesday, angry residents stormed and barricaded the Funtua-Sheme Highway in Katsina State in protest of the continuous attacks in the area. Family of late Sylvester Oromoni, a 12-year-old student of Dawang College, allegedly murdered in Lagos State, faults the bail granted to suspects by magistrate court in Yaba. Trust TV's Onora Aningwobodo reports that father of the slain student in Asaba, the Delta State capital, queried the court's decision. The report.
Mr. Sylvester Oromoni, father of the slain student, wondered the rationale behind the bail when the 21 days request by the police for investigation is yet to elapse. He said releasing the suspects might hinder the investigation, noting that while the family is not against granting the bail, the court should have waited till the end of the 21-day period.
Now called Commissioner of Police Lagos State. He told me that they were not aware. That was the first. That they are not done with their investigation. And called the DCP in charge. He called his people too. And he later confirmed to me that the story is true. But it was a surprise to them that the same judge gave them 21 days that will expire on the 28th of this month. Because they requested for the mind order. They wrote to him and he granted them 21 days to keep those boys. Now, the 21 days has not expired. He granted them bail. He has his reason. The police are saying that they are not done with their investigation. That granting these boys bail will not help them in their investigation. They are getting more facts. And that they were even planning after the 21 days, if they are not done with their investigation, they will write for extension.
While calling for justice, the bereaved father disclosed that the autopsy results are ready and will be made public in due time. He alleged that the school authorities, in connivance with the parents of the accused, may be working against his quest in seeking justice for his late son.
I'm not questioning, I'm not a lawyer, but with what the family, the father is saying, if you allow, you should allow police to complete their investigation. At the autopsy, we, as a family, we contacted the police in Delta, area command, to be specific, and they carry out autopsy. And that one, the result is, except one, that they said that one will take some time. That one, as I'm talking to you, is with me. But we are not going to make it public because the Lagos State government, the family of the boys in school, they're also doing another one. We're also waiting for that one. But we have our own.
A Lagos State Chief Magistrate Court sitting in Yaba granted 5 Doim College students accused of the alleged assault and death of 12-year-old Sylvester Oromoni bail in the sum of 1 million naira. Honora Aningwobodo for Trust TV.
Nigeria's Center for Disease Control has reported 4,035 cases of COVID-19. The agency, in its update for Wednesday, said the new cases were logged in 15 states. According to the center, while 92 persons were discharged after recovery, 2 persons died of the infection. The country's death toll now stands at 2,991, with 231,413 cases and 211,853 cases discharged. In another development, the United States Food and Drug Administration on Wednesday has authorized Pfizer's antiviral pill Paxlovid to treat COVID-19. This is the first antiviral COVID-19 pill authorized for ill people to take at home before they get sick enough to be hospitalized. Similarly, Nigeria has entered the 4th wave of coronavirus, according to the Nigeria Center for Disease Control. A 500% increase in the number of cases in the past 2 weeks is recorded. This data indicates that only about 8 million Nigerians are vaccinated, and unvaccinated people are likely to die from the virus if infected. Trust TV's Nafisa Abdul-Al speaks with a cross-section of Nigerians on the pandemic.
The 4th wave of the COVID-19 pandemic is biting harder in Nigeria, as the country on Tuesday recorded 4 deaths and 2,123 fresh cases across 10 states of the Federation and the Federal Capital Territory. The development represents the highest cases recorded since January 2021. According to Director General of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, over 8 million Nigerians have taken the vaccine safely, and out of every 10 people that have died, 8 of them are unvaccinated. Meanwhile, some Nigerians react to the statistics.
Actually, I really don't believe in coronavirus, so I don't believe in the vaccine. I actually just believe that God has the power to keep everybody safe. We just have to be careful and be prayerful. Statistics will always come out, and sometimes people actually forge these statistics in order to make money. They may not actually be real. What is the probability that those statistics are very real?
Well, I won't say the vaccination is a cure for it. It just gives us the immunity to fight against, especially when you've taken the second dose. So it basically just gives us the immunity. It's not as if it cures it totally. No, but we still hope that the World Health Organization will bring out something that will totally eradicate the virus.
So I enjoy all Nigerians to comply with government directive to take the vaccine. We have taken the first dose and second dose. And this Omicron one that is coming, we should also take the vaccine so that all of us can be cured.
About the vaccine, where I want it because of you people, so that we can take care of ourselves because of this corona. But then some people, they have not carried serious about this.
Well, I think the vaccine will definitely help people to get infected by the disease. I believe it's very essential for every Nigerian to take the vaccine.
The Nigerian Center for Disease Control says Nigeria has recorded a 500% increase in the number of confirmed COVID-19 cases over the past 2 weeks across the country, caused by the Delta and Omicron variants. Nafisa Abdul-Al, Trust TV News, Abuja.
Still talking health, federal government on Wednesday destroyed over 1 million doses of AstraZeneca vaccines donated to combat COVID-19. The executive director, National Primary Health Care Development Agency, Faisal Shuaib, led the destruction at Gosa dump site, about 2 kilometers from the Idu railway station in Abuja. He said the vaccines did not expire before the decision to withdraw them, noting that the exercise provides the opportunity for Nigerians to have further faith in the vaccination program. With the exercise, Nigeria joined other African countries like Malawi, South Sudan, Liberia, Mauritania, Gambia, Sierra Leone, Guinea, Comoros, and the Democratic Republic of Congo in destroying the expired COVID-19 vaccines. In Kebbi State, emergence of the Omicron variant of the COVID-19 virus and the increase in reported cases of COVID-19 has thrown a new challenge of preventing transmission of the virus. In this report, Trust TV reporter Hamza Galadima examines efforts in Kebbi to mobilize people to submit themselves for vaccination against spread of the dreaded variant of COVID-19 Omicron virus.
The latest strain of the COVID-19 virus has, over the past few days or months, spread across the globe, spreading anxiety in medical cycles. The Omicron virus, coming on the heels of its Delta counterpart, was discovered in South Africa and has since spread to other parts of the world, including Nigeria, which recently announced its presence a few days ago. Dr. Tuko Moses Tari, a specialist in infectious diseases, explained how the Omicron virus came to be and how infectious it can be compared to the earlier two variants of the COVID-19 virus.
So we now have the virus changing from one form of the disease, maintaining the same identity, but having some unique genetic property that is slightly different from the others. So when you check the sequencing of the disease, that's what we call genetic sequences, like you profile the gene, then you now discover from point A to point Z, then maybe at point Q, there is some change in the genetic component, and that Q is the part that helps it to overcome maybe temperature, maybe let's say an antibiotic we are giving it, or maybe an antiviral agent. So it has changed. We had initially the Delta variant, which was properly known. Omicron is not the only one. Delta variant, and it came in, and a lot of vaccines came in to be able to overcome the Delta variant. So now it is thought that in South Africa, sometime about, I think September or so, is within this year, just about 2 months, 3 months ago, for the first time they detected a new strain now of disease with some genetic component, and it was now labeled Omicron. So, and a lot is evolving about Omicron from there till now. So this is some short story about Omicron variant, but it has made its debut in Nigeria, and now Omicron variant has been identified in Nigeria.
With the possibility of another lockdown in the offing, authorities in Kebbi State, like most other states of the Federation, have scaled up vaccinations against the virus, with centers springing up in public places in an attempt to check its spread into the state. Apart from the major medical facilities like Sir Yahya Memorial Specialist Hospital and the Federal Medical Center, all in Birnin Kebbi, the fight against the virus has been taken to ministries and parastatals, where civil servants are required to take a shot of the vaccines. However, on the other hand, other safety measures in public places are visibly not in place, as over 70% of people going into public places such as markets, schools and recreational centers do so without wearing a face mask. And basins for washing hands have virtually disappeared from such places.
Most important advice I will give is one, prevent it. So how do you prevent it? Know about it. And that's one. So there's a lot of myths there, and I'm happy we're having this interview. There's a lot of myths outside there. I have said you one classical one I've said is droplet. It's you breathe it. It's either you breathe it in or you transmit it by yourself or your hands to your nostril. For instance, even if it's on your palms, the virus, so long as your palms do not make contact with your nostrils or your mouth or any other orifices which is remote, but the mainly is breathing nostrils or the mouth, it will die in the palms. So how do you prevent it? The same thing we say, keep that safe distance, which is still 1 meter for those who are symptomatic. Or if you are in a close proximity, use of what? Face or medical mask. That's why it has been, because what it traps it in and it doesn't go. So this is what the world should know. These have not changed. Things are evolving, but these have remained what? The same. So you prevent it by getting knowledge to taking those infection prevention control measures, which is what? Hand hygiene, use of mask. Then importantly is what? Vaccine.
Kebbi State was one of the frontline states that played a major role in fighting the spread of COVID-19 when it first made its debut in 2019 with one of the lowest infections among the populations. But with the Omicron virus on the loose and the people's attitude towards the looming danger, this time the story may be different. Hamza Galadima reporting for Trust TV News from Birnin Kebbi.
Despite concerns over rising cases of COVID-19 infections during the fourth wave, many Nigerians embark on journeys to celebrate Yuletide festivities. Nigeria Center for Disease Control has advised Nigerians to skip non-essential international and local travels during the festive period. Trust TV's Aisha Salihu visits Jabi Park, Abuja to inquire about adherence of travelers to safety precautions.
The rise of the COVID-19 Omicron variant does not appear to be keeping travelers home for the holidays, as they embark on their journey to spend the Yuletide with families and loved ones. Although some say they continue to maintain the COVID-19 safety regulations.
Well, my concerns at this moment is one, people are not really taking things serious as it should. Especially the universal precautionary measures, the washing of hands and the social distancing and the rest, wearing of face masks. As you can see, just very few of us are with our face masks here in this garage, which is not supposed to be so. Nigerians are so relaxed, maybe because people, they have never seen very close persons die within them, but I feel everybody should be concerned because this is a global health issue.
Yeah. Well, of course, I'm a bit skeptical when I come into crowded places like this. As you can see, I'm wearing my nose mask, but I'm always careful, trying to avoid people. You know, somehow we can't do without it. We just have to mix up with people, and I've not really been home for a while. So I need to travel. So I'm just trying to observe the precautions and all of that. Even though I know the car may be a bit clustered, but still I have my mask. And yeah, that's just my own way of and guiding towards getting too close to people when you're having face-to-face contacts and all of that.
Sincerely, it's more like you see, I'm properly kitted, covered my skin and everywhere, and it's because if not I would have worn hand gloves as well, but that aside though, but it's more like I hope I don't breathe in something. I hope somebody doesn't sneeze close to me, and if the person sneezes, I hope it doesn't touch me and all that, all those. But it's at the same time, it's more like I'm pretty sure it's not going to come close to me.
Yes, I'm actually traveling to go see my family for some days because I'm kind of overwhelmed here with work. Well, I feel like COVID-19 is still real because I can remember a couple of times around last 2 weeks, I have some symptoms. I developed some symptoms, cough and chest pain. So I went to the COVID-19 center. I had my COVID test, but then it's just unfortunate for Nigeria that I still haven't seen my results yet.
The problem is now that they're about COVID-19. We actually COVID-19 is true, but what has happened? Normal, like this Sharon now, would they carry 7 passengers, but because COVID-19, we need to carry that 7 passengers. Actually, what would they carry? Would they carry 2 in the back, 3 for here, 1 in the front?
There's not much worry because of the available preventive measures like wearing of nose masks and rest of them, and social distancing.
The Nigeria Center for Disease Control also advised Nigerians to take caution during the Yuletide to avoid transmission of the infectious disease. Aisha Salihu, Trust TV News, Abuja.
You're still watching Trust TV News Update. Coming up after the break. Ambition of a 13-year-old quarry worker. Do stay with us.
The board and management of Media Trust Limited invites the general public to its annual Daily Trust Dialogue, themed 2023, The Politics, Economy and Insecurity. Date, 20th January 2022. Location, NAF Conference Center and Suites, Abuja. Time 10 a.m. prompt. Chairman of the occasion, former Head of State General Abdulsalami Abubakar, GCFR. Guest Speaker, Governor of Kaduna State Malam Nasir Ahmed El-Rufai. Guest Speaker, Governor of Ebonyi State Engineer David Umahi. Guest Speaker, former Chairman Federal Inland Revenue Service Mrs. Ifueko Omoigui Okauru. Moderator, Executive Director, Daria Media Nigeria Limited, Kadaria Ahmed. The event will be transmitted live on Trust TV, and all participants must observe COVID-19 protocols and wear their face masks.
Get latest updates on current topical issues and breaking news by downloading the Trust TV mobile app on your Android devices. Go online, click Google Play Store, search Trust TV, install the app, and get doses of unfiltered information on happenings all over the world in your pocket. Trust TV, documenting the Nigerian story. Welcome back and thanks for staying with us. It's still Trust News Update. Let's take a look at some of our top stories. You heard that bandits have killed at least 8 persons and abducted 17 women in Faskari local government area of Katsina State. And family of late Sylvester Oromoni, a 12-year-old student of Darwin College allegedly murdered in Lagos State, have faulted bail granted to suspects by a magistrate court in Yaba. Breaking news just reaching us says that while waiting the arrival of President Muhammadu Buhari for official working visit in Borno State, Boko Haram has attacked 3 communities at Ngomari Airport General Area in Maiduguri, the state capital. The attackers appear to be targeting the airport before the arrival of the president, who was scheduled to arrive at 11 a.m. and the attackers hit around 10:45 a.m. Some locals told Daily Trust that the attackers hit the communities with rocket launchers, killing unconfirmed number of people, destroying residential areas and properties. Details later. Moving on, Maiduguri residents have expressed happiness over the recent flash of electricity in the capital. The city has been without power for 11 months, which has almost crippled business activities in Borno State. The report.
Maiduguri city has been in total blackout for a year. All efforts to fix the power installations that link the state to the national grid continue to suffer disruption from the dreaded Boko Haram group. The state government early this month had promised Maiduguri residents electricity restoration in 30 days' time, and until recently, there was a brief flash of electricity in some parts of the capital.
A lot of people come to me and told me that they spend the night with electricity. The light has returned to some areas. We have been suffering. It stopped a lot of works. Many things stopped working because our people are suffering. Especially we students, it helps us to read at night sometimes.
Yes. I heard that when I went to camp, they repaired the light and less than a month they destroyed it again. But we are happy now. The light is back. So we are hoping to get it in our area too. It's not easy. To charge phone, to watch movie and other things. So it's not easy, but we have been coping though. But it's not easy.
I don't see any light, so there is no light in Maiduguri. Let me say, it's getting to a year now. We have not seen any light in Maiduguri. In fact, we are suffering in Maiduguri. We even tried to relocate because of this dark night. We are suffering dark night. Let me say. Another state, there is light in their state, but here there is no light. We are not happy. In fact, more especially, I myself is not happy.
The long power outage had huge impact on business activities and forced business owners to rely on generators. Musa Buba, who runs a water sachet factory, says it has to reduce daily production because of an increase in diesel price, and the blackout is affecting supply as expected by customers.
That's our real major problem, the diesel, and they have increased the price. You know, I think last month or last 2 months, we used to buy 270, 280, high is 290. But now we used to buy diesel 350 per liter. 350, and daily we used to consume 116 liters a day, making total of 40,600 naira daily, and we can't get that profits here. I heard they say that even if they bring the light, it will not reach like 5 to 6 hours a day. So maybe it will reduce something little bit, but at least if I can get 12 hours, I will get something.
Residents hope that the return of electricity will remain stable and not sabotaged by external threats.
Quarry work is hard labor, which entails surface excavation for extracting stones used as building materials and other purposes. To put food on the table, a cross-section of youths in Gombe State extract stones for money. Among the quarry workers, Trust TV's Ibrahim Ismail meets a 13-year-old that aspires to become a medical doctor. The report.
This is a 13-year-old Abdullahi Haruna, a primary 5 pupil of Kagarawal Primary School, Gombe, who works at a quarry site located in the outskirts of Gombe metropolis from the eastern part of the city. Schools are on holiday, and the youngest quarry worker here spends most of his time working to get some money.
I used to work for my boss. I do some savings and sometimes give my mother to keep for me. When the money accrued, I bought a bicycle.
Abdullahi, who aspires to be a medical doctor, said he wants to put more effort in the quarry work to support his education.
I want to put more effort to become a medical doctor and help people.
Other senior workers said the business has been a source of sustaining their families for years.
With this work, I married 2 wives, have a ride and a house, but my educational qualification is secondary school. I have no occupation rather than this work. Thanks to Allah, now I am building my house.
There are hundreds of quarry workers in various locations in Gombe who depend on the work to fend for their families and help generate revenue.
With that, we've come to the end of Trust News Update. Don't forget to follow us across all our social media platforms. I'm Dashin Husseina Usman. Thanks for watching.